Modita Ahuja, consultant gynecologist and laparoscopic surgeon from Delhi. So today I'll be telling you about few of the causes about irregular periods and what are irregular periods. To know about irregular periods, firstly it is very important to know that what regular periods means. So if your period cycle lasts between 21 days to 35 days, then it is known as regular periods. And if you are getting periods which are earlier than 21 days or later than 35 days, then these are considered to be irregular periods, and then you need to consult your gynecologist. So to maintain a proper record of your period length, it is important that you track your period using a period tracker app. Also, in some girls who have just attained menarche or who have just started bleeding, in those cases it takes at least 2 to 3 years for your periods to become regular. This is because the hormone which are secreted from the brain, the axis, that is the hypothalamo-pituitary axis, is not well developed, and it takes almost 2 to 3 years for it to mature so that the periods can become regular. But it is important to know at that particular time also that if your periods are regular or not. So it is very vital that from the very beginning of your first period cycle you should track your periods and you should know the length of your periods. Now, some of the few most important causes of why there are irregular periods are: number 1, pregnancy. So in pregnancy, the most common symptom will be missed periods, and along with the missed periods, there will be other symptoms also like nausea, sore breasts, etc. To know if you are pregnant or not and if you have missed your periods, then you should definitely test it using a urine pregnancy kit. The second most important cause of irregular periods is PCOS. In PCOS, there are other symptoms also along with irregular periods like excessive weight gain, excessive hair growth on your face, acne. These are few features suggestive of PCOS. So if you know that if you have irregular periods, consult a gynecologist to get diagnosed with PCOS. The third most important cause is thyroid imbalance. So thyroid is very important in the production of your sex hormones, that is estrogen and progesterone. So if the thyroid hormone is not sufficient or is secreted in excessive amount in your body, then in that circumstances the periods can vary from light to heavy bleeding. So if you have hypothyroid, that is if you have less of thyroid in your body, then your periods will be heavy and they will be prolonged. But if you have less amount of TSH or more amount of thyroid in your body, then in that circumstances your periods will be scanty and they will be irregular. The next important cause is certain medications like antidepressants or certain hormonal pills which can cause irregular periods. The next important cause is the hormonal birth control pills. So when you are on birth control pills, basically what is happening is the egg is not released from the ovary. So the periods you are getting, they are just the fake periods and they are not because of the egg being released from the ovary. So if you miss your pill or if there is any imbalance in taking of those pills or disturbed in schedule of taking those pills, then in those circumstances you can have irregular periods. Other risk factors are like endometriosis. Endometriosis is nothing when the lining of the uterus grows outside your uterus, and because of which a woman can suffer from heavy bleeding or periods in between the cycles or spotting. And along with that, there is excessive dysmenorrhea or pain during periods. So in these circumstances also you should consult a gynecologist. Definitely there is a treatment for endometriosis, and if the symptoms are caught early, then they can definitely be subsided in a better and a much effective way. Other and the less likely causes of irregular periods are being underweight, being overweight, or excessive exercises or excessive dieting. So in these conditions you can have irregular periods. So these are the some pointers or some reasons which I have pointed out which can cause irregular periods. But in case of irregular periods, and if on period tracking app it shows that you have irregular periods, then you should consult a gynecologist. And if you have any concerns, you can consult me anytime on MFine app. I hope it helps. Thank you.
Don't forget to like and share this video. For more such videos, do subscribe to the MFine channel and hit the bell icon to never miss any update.